The Ayushman Bharat Digital Mission was officially launched today by Prime Minister Modi. It was already available in about 6-8 states as a test drive, and today has now been given the green signal to be rolled nationwide. Now, what is it? It is a unique 14-digit digital health ID that will be given to every citizen that registers and will contain in it all of that citizen's medical records and data. How it helps is that it will help that citizen keep a track of what has been happening, help their doctors keep track, and will also help governments make policy decisions. It goes beyond that. The aim is to build an infrastructure, a digital infrastructure for health, where you will have a database of hospitals, doctors and healthcare providers, even pharmacies available on that one platform, and it will make it easier for citizens to have this access. Let's first begin with what Prime Minister Modi said while launching this mission.
आज एक ऐसे मिशन की शुरुआत हो रही है जिसमें भारत की स्वास्थ्य सुविधाओं में क्रांतिकारी परिवर्तन लाने की बहुत बड़ी ताकत है। साथियों, 3 साल पहले पंडित दीनदयाल उपाध्याय जी की जन्म जयंती के अवसर पर पंडित जी को समर्पित आयुष्मान भारत योजना पूरे देश में लागू हुई थी। मुझे खुशी है कि आज से आयुष्मान भारत डिजिटल मिशन भी पूरे देश में शुरू किया जा रहा है। ये मिशन देश के गरीब और मध्यम वर्ग के इलाज में होने वाली जो दिक्कतें हैं, उन दिक्कतों को दूर करने में बहुत बड़ी भूमिका निभाएगा।
Ashutosh Raghuvanshi, MD and CEO of Fortis Hospitals, and Viren, Shetty, ED and CEO of Narayana Health, joins us on the show to speak more on this. Welcome to both of you, and thank you for speaking with us this evening on the India Development Debate. Dr. Raghuvanshi, let me begin by asking you how you think this will be implemented. It also envisions the private sector participating, and in India that would definitely be a big need to make this a success, considering that most Indians do rely on the private sector in some shape or form for their healthcare needs.
I think, as the Prime Minister said, Tamana, it is a very, very powerful initiative. It has immense power in transforming the way healthcare is delivered. Private sector has already been involved in the initial stages at the kind of, there is an initiative called Sandbox, where laboratories and hospitals are participating in the process of standardizing the data flow through this system. So I believe the implementation is going to be very effective. We have been very actively engaging with the government agencies on this for some time now. Past few months, we have been involved with this. And I think the implementation will be time consuming. So this will not happen overnight. But this is an extremely powerful tool which has been unleashed. It will transform the way the healthcare is delivered in the country. And as the Prime Minister himself said, that whether it is the transformation of the last mile of care, the problems which people face maybe during portability of records, carrying records from one place to the other, transmission of records to the payer, say to the insurance, etc. So all these things are going to completely be addressed. There's nothing of this nature which has ever been attempted or tried anywhere else. So this is a very unique initiative, but I am absolutely confident that as we did the Aadhaar, this is also going to be implemented reasonably well, and I think it will transform the way healthcare is delivered over the next few years.
Viren, why don't you come in with your views? When one thinks about healthcare data, even at an individual level, it is so scattered. We don't have a situation where an individual has to go to one doctor in their area. We believe in second, third opinions. There are so many different kinds of prescriptions that come through. A lot of Indians just sometimes get their prescriptions from the neighborhood chemist. So in this kind of a chaotic system, how are they going to bring order through data, and what is the involvement you see of private organizations?
Well, a unique health ID doesn't solve all these problems, as you said. It just gives a common address for all these different scraps of paper to find a home. So in that sense, the ones who are most able to take immediate use of it are organizations like ours that have invested in IT for decades. And so we have everything electronically registered. And so now we can put everything that we have about a person in one common area. The chemist, the small clinic, the pharmacy, the unorganized doctor, they will eventually be brought on board when they also start to implement electronic medical records. Now, the role of the private sector is, now that everything is standardized and it's clear how the data needs to be written down, it is up to the private sector to come and build solutions on top of this platform for the next, the bottom 90% of all the people who currently don't have electronic medical records. So that is the next step, which I think both the government and the private sector would work together towards solving.
The other big concern, of course, is privacy and consent. What has been made clear is that these health records will be shared onto this platform only with the consent of the patient. Dr. Raghuvanshi, will people consent to this? Because where this is different from, say, Aadhaar, which also had privacy issues, or any other such big government scheme, is that health is very, very personal and it's very, very touchy. There are some ailments that people don't even share with those who are nearest and dearest to them. So will they feel comfortable having so many entities handle their private data? And how will hospitals ensure that this data goes into a central system only with the pure and clear consent of that patient?
Yeah, so I think there are many things which need to be resolved in terms of how exactly it will be implemented. But many of those privacy concerns have been already taken care of. Consent is, of course, important. But what is most important is that the control is with the person himself. So the access can be provided to a provider, a carer, only if the patient consents to do so. And they sort of allow that information to be seen by the caregiver. So that way, I think to a large extent, these concerns will be taken care of. As far as privacy laws and the data related issues are there, that is also being addressed at a wider scale, not only for the medical health ID, but even for other issues. Those regulations are also in place, and from January, they are likely to be implemented. So I think that has been adequately addressed before this scheme has been put in place.
Viren, do you share that sense of confidence? Will privacy concerns now rear their head, and also getting consent of people? I mean, there might be some who will happily give consent, but then there will definitely be people who would not want their medical data to be in a place where others can access it.
You're right. There is no amount of preparation you can do in advance of knowing exactly how people will behave, or in advance of knowing exactly how data has to flow between multiple stakeholders. Because the way it is envisioned now is that the data can flow freely between hospitals, clinics, government centers, a central database. And the thing about in a network, the strength of the network is where it is weakest. And it could be that a large organization has invested a lot in the highest end data security and protect against cyber attacks. And it could be that there will be some basic, very entry level databases that don't invest in that sort of security. And so you have instances all the time of credit card details and people's information going out, getting hacked and stolen. But the truth is, there is no one in the world who does this perfectly. The biggest multi-billion-dollar companies in the world are also not able to keep our data neither secure or safe or private. So it's a little unreasonable to expect a third world country that has a barely functioning health system to be able to address everything possible, but it is better than the alternative. Uh, if you compare what it is against not having this, against not having doctors be able to read your medical records, against not having your entire history available to every health practitioner, I would say it's far better where we are now, and we will evolve those standards and we will get to a point that can address all the patients' need about safety and security. But we can't address all of it from day one and build a perfectly secure system, because that just means no one share anything with anybody.
Dr. Raghuvanshi, how crucial is it from the medical professional's point of view to be able to access all of these medical records? Because the standard process right now is, you go to a doctor with a complaint and they send you to do a battery of tests which they deem fit and then move on from there. I mean, that process won't really change. So explain to us from the doctor's perspective why this will help.
Oh, it'll help immensely. It'll change the way the consultations are done, because you will have a linear information about a patient's health. So any episode of illness is not an isolated episode which needs to be treated. Suppose a person has a heart disease, for instance, when they come to us for diagnosis or for a particular ailment, we need to know whether their thyroid status is normal or not. We need to know whether their diabetes is all right or not. Before we decide on the course of treatment, we need to know how their diabetes control has been there. So all that information, relevant information being in one place is extremely important. To emphasize my point, I will give you an example. What happens is that many times some comorbid conditions are not identified before the surgery or the procedure happens, because either the patient forgets to inform the doctors or it is not documented properly. With this, all those errors will get eliminated. What medication patient is on? Are there any side effects of that? And if a new medication is to be added, whether it is contraindicated because an already existing medicine is there. But I think, as Viren was earlier describing, this is not something which is going to sort of start making decisions for the patient or for the physician, but this is a highway of information. It's like a neural system which can transmit information seamlessly. So what it will do is that it will efficiently take information from the laboratory to the doctor, to the insurance payer, from the patient to the pharmacy, to the physiotherapist, to the home care person, etc., etc. So that is the power of the tool. So initially, people may have hesitation in putting their records in there, but once they realize the benefit, advantage, and the ease of taking care of their health, and automatically the outcomes will improve, the errors will go down. So with that, I think the acceptability will gradually increase.
Yeah. The other question, Viren, is how will the data be collated? Who does all of this data generation? So will it be patients who will be expected to put in their details somewhere? Will it be every laboratory, pharmacy, hospital, healthcare center where that data is first generated? That will be the font or the source of that data?
Every spoke of the chain is a generator of information. Ultimately, the patient owns all of that. So if I visit a hospital, everything the hospital says about me, all the tests they do, all the things that they do on me, that forms part of a medical record, that is now my property. And if I go to another hospital or another clinic or the insurance company, they add more things to that. So that becomes, again, added to that longitudinal record. So everyone ultimately is contributing to it in different points. Now, obviously, there are things that are more relevant, which is whatever's most recent is the most relevant, whatever is in the past is the least relevant. I'm not so sure about patients contributing the medical data themselves. There are instances, for example, for patients that we pre-register where we ask them to self-test. So there are certain things you can trust patients to tell you, like their height, their weight, their age, their gender. Those sorts of things we can trust them for. But for a lot of medical data, it's better that there are identified data fiduciaries who will be, you can trust that the data that they're inputting is coming from a reliable source.
Yeah. So it is going to be, trial and error initially. I think the first step has been taken. We have to remember a point Dr. Raghuvanshi also made in this conversation. This is not going to start getting implemented overnight. It still has a long way to go, but it promises to be a game changer. Thank you so much, Dr. Raghuvanshi and Viren Shetty, for joining us on the conversation today.